In a memo to staff, he cautioned against using gendered language. The list of do not use phrases include manpower, you guys, ladies and gentlemen, mother, father, son, stepdaughter, and husband, wife.
I lived 8 years as Laura Jensen until I woke up and realized that it was totally insane to live this out. The first time that it happened in the 50s was Christine Jorgensen, but Jenner took it to the next level, and then 2015 it began to explode.
Are you a woman?
Yes, for all intents and purposes, I am a woman. My brain is much more female than it is male.
Ladies and gentlemen, the courageous, the stunning Caitlyn Jenner.
We're ruining an entire generation of children. I find even hearing about it and reading about it so repugnant and so destructive to children.
Trans members of this family all love each other so proudly, and they all...
Bringing drag performers together with little kids is kind of a perfect relationship.
There are people whose gender might be a little bit of both or might even be neither.
And it's time that this stuff needs to end. We need men and women to step up and say, stop this nonsense.
Gender dysphoria is a condition where a person's physical, biological sex is one, say a boy, but in the person's mind they think they're really a girl, or vice versa. It's not something that you can identify on any objective test. You can't do a blood test, for example. You can't do MRI imaging. You can't do genetic testing to actually find this gender identity. My name is Dr. Michael Laidlaw. I'm an endocrinologist in Rockland, California. This gender identity, which is really a child saying, I believe I'm this, I believe I'm a boy, I believe I'm a girl, something opposite of their body. Once they say that, they go down this road of gender affirmative therapy. That consists of social transition, wearing, say, stereotypical clothes of the opposite sex to pretend that they're the opposite sex, then these puberty blockers, then these cross-sex hormones, and then finally surgical modifications to the body to try to make the person appear that they're the opposite sex. Puberty blockers are powerful hormones. They act on a small gland in the brain called the pituitary, and this controls the sex organs. For example, testicles make testosterone, ovaries make estrogen, and the pituitary controls that happening. Now, these blockers stop this action, and then whereas, say, a girl is in age 9 and continuing or beginning to develop in puberty and should continue on until a full adult woman, it's stopped. Once you stop it, there are various harms and problems that occur afterwards. Unfortunately, many of our professional organizations are advocating for this, including Endocrine Society. And it's important to bear in mind that there's very small groups of people controlling these societies. Small groups of people are making these pronouncements, and then when physicians want to turn to what's the best practice, they're finding these things. And there's no rigorous research done, there's no controlled studies. It's very poor research, but it's, I guess, politically correct to go down these roads by these organizations. Doctors will feel compelled to follow what their organization says without really looking into the evidence necessarily. There is heavy-duty propaganda basically going on, but these gender clinics have sprung up and have multiplied all across the country. The numbers are going up around the world, in the UK, Canada, here, other places. More and more kids are being diagnosed with this, and there's a social contagion component. People, kids going on to YouTube, Tumblr, things like that. So the cases are rising. It's a major problem that we have to address. In my practice as a physician, I always look at side effects of medications before I give anything to anyone. Say for diabetics, I always tell them, if you can work on your diet and exercise first, I'd rather have you do that than take these medications, because there's side effects and there's problems that are potential. But if you need it, then you need to take it. With this, I can see no need to take these medications. I see the risks as being very high, and I see children as a very vulnerable population, can't speak up for themselves, and their parents are often propagandized by this movement. I've met a lot of these parents. My heart goes out to them. I've seen their kids and pictures of their kids, and really, it's about helping kids.
There's 6 sexes, genders in the Talmud with many mentions. Let's get into what they are. There's Nekeva and Zakar, the two you hear as female and male. Androgynous for an intersex person with both female and male sex characteristics. Tum, a person with obscured or unclear sexual characteristics. Halo needs someone assigned female at birth, but who expresses male characteristics later in life. Sorry, someone assigned male at birth, but develops female characteristics later in life and or has their sexual organs removed. Saris and Eloni often are described as infertile, and while life has lots of rules, don't let binaries be a hurdle to loving yourself or exactly you.
The Lord God has prohibited homosexuality, and when He destroyed Sodom and Gomorrah because of homosexuality, He destroyed them in a way that would send a message for the rest of mankind until eternity. That if you return to this, I will return with my punishment. And what they're doing today is forcing upon the governments to legislate for marriage of a man with another man. And if you don't do it, your money is going to be attacked. Your economy can be destroyed.
We have 5 children's hospitals in the United States promoting that.
What?
That's a phalloplasty. That's a bottom surgery. We have 5 children's hospitals in the United States telling girls that they can be boys at $70,000 a pop in a surgery that has a 67% complication rate. That will kill me from infection, that I can't sue on. We're butchering a generation of children because nobody's willing to talk about anything.
But what do you think about parents that are protesting all over the place, where in some districts, these guys are saying, no, this is recommended reading by the teacher and it's normal, it's okay, you should learn about this at an early age. How do you feel about that?
Well, I think it's very clear that there are certain teachers that have an agenda, and that their agenda is to indoctrinate children into this LGBTQ mindset, and that this is not just cherished but celebrated.
Homosexuality is not a choice. So why does Allah punish the gay community?
If you look in the Quran, Allah subhanahu wa ta'ala does not talk about how you feel about somebody else. He specifically talks about people doing certain things. It's the action that matters. So you might have certain feelings, and if you look into the research on this, actually is quite interesting. Most people, and this is something that might come as a shock to a lot of Muslims, most people are actually not exclusively like just hetero or exclusively homosexual. It's a matter of social conditioning, environment, combined with internal inclinations and dispositions. Majority of people are going to be on the spectrum of heterosexual. That's the majority, the overwhelming majority. But social conditioning is very powerful, and it can drive people. If you look into the graphs of how many people per generation, the percentage of the generation that's identifying as LGBTQ, it's just like rising up and up and up and up. And the question you should ask yourself is, wait a minute, humans have been around for like 100,000 years. This is a very rapid change in the way that they supposedly are inclining and feeling with something so fundamental as reproduction. Because like it or not, a homosexual cannot procreate in a homosexual relationship. The fact that we have some technologies nowadays that allow us to do certain things outside of normal cohabitation between the male and the female does not negate that. So the question you should ask then is, okay, wait a minute. Allah created us, yeah, we have some feelings, but are we being punished for that? Or is there something the society is doing, or what's happening? You have to engage with this at a little bit of a deeper level. So the Quran never punishes people for feeling a particular way. It's always about acting in a way that is contrary to what Allah subhanahu wa ta'ala and His Messenger sallallahu alaihi wasallam commanded.
Male gametes, that's what makes me male.
No, your sperm don't make you male.
Then what does?
It's a constellation.
In reality, in truth, okay?
Whose truth are we talking about?
the same truth that says we're sitting in this room right now, you and I.
No, you're not listening.
If I see a chicken laying eggs and I say that's a female chicken laying eggs, did I assign female, or am I just observing a physical reality that's happening in the world?
Does a chicken have gender identity? Does a chicken cry? Does a chicken commit suicide? Let's frame it, because you're trying.
The chicken has sex like any biological
chicken has
organism.
an assigned gender, but a chicken doesn't have a gender identity.
So we assign female to chickens when they lay eggs?
We assume they're female if they lay eggs.
What my concern with is that a lot of what we're seeing with, like, New Jersey had an uptick in kids identifying as non-binary by 4,000%. Like, it's not natural. These are not normal numbers. And I think children are very malleable. They're very impressionable. And if you reward them for certain kinds of behavior, if they are praised and cherished for certain types of behavior, I think they'll be encouraged to do that. And I think you're seeing with a lot of these detransitioners that a lot of these kids got encouraged early and got put on hormone blockers and hormones and got mastectomies and got castrated, and now they have deep regret. And people don't want to acknowledge that, and they attack those people. They attack those detransitioners. We have always thought that young children are not capable of making life-changing decisions at an early age. That's why we don't allow 7-year-olds to get tattooed. Right. And now all of a sudden you're allowing 7-year-olds to say that I'm a girl or I'm a boy, cut off my breasts and put me on testosterone.
Yeah.
That's craziness.
What?
Ruby began identifying as male at 13 years old. Now, 21, she'd been planning to have surgery to remove her breasts. But in May, she made the decision to come off testosterone and detransition to identify as female, her sex at birth. She doesn't want to be identified, so we've changed her name.
I figured it would be better for me to try to deal with my gender dysphoria in a different way, rather than permanently changing my body.
How much support did you feel was out there for you when you came to this conclusion?
I didn't feel like there was any support out there other than like a few friends online.
Ruby now feels her eating disorder was more of a factor than she first realised in her gender dysphoria.
None of the therapists that I spoke to brought that up. They didn't think that it was linked.
Do you?
I think so, yes, because they're both kind of based in how I feel about my body, so I've seen similarities between the two.
Charlie Evans is forming a charity to support people in Ruby's position. After going public with her detransition story, she discovered an online community of 5,000 in a similar position, 30 people alone in her area of Newcastle.
I was approached by a young woman with a beard, and she hugged me and said, I'm a detransitioned woman as well, I've just stopped taking testosterone. And after that I felt like I had to do something. I'm hearing from hundreds of people, and I think some of the common characteristics are they tend to be around their mid-20s, they're mostly female and mostly same-sex attracted, most are lesbians, and often autistic as well.
The Tavistock and Portman NHS Trust told us the experience of regret described here is extremely rare. Their gender identity service for children in Leeds and London now has a record number of referrals. The clinics here and in London see 3,000% more patients than they did 10 years ago. Among girls, referrals are up more than 5,000%. There's no question this service is helping children who feel distressed in their own bodies. But the full impact of children making decisions about their gender at such young ages may not truly be clear until much later in their lives.
My name is Miriam Grossman. I am a board-certified child, adolescent, and adult psychiatrist, author, and senior fellow at Do No Harm. I have been taking care of patients for 45 years. I'm going to use my time to respond to Dr. McNamara. First, I'm struck by her use of the phrase, sex assigned at birth. Sex is not assigned at birth. Sex is established at conception and it's recognized at birth, if not earlier. Dr. McNamara claims that her views are science-based, but to claim that sex is assigned at birth is without any scientific basis whatsoever. Its language misleads people, especially children, into thinking that male and female are arbitrary designations and can change. That is simply not true. Dr. McNamara claims that social and medical interventions are the only evidence-based treatment and that scientific evidence shows it is life-saving. Without it, she's warning us, kids will commit suicide. Well, a growing number of countries have effectively banned the care to which she's referring. And thank God there's been no wave of suicides or other mental health catastrophes. 3 years ago, Finland placed strict limitations on medical interventions for minors. Sweden did the same thing after a 14-year-old girl was found to have osteoporosis and spinal fractures from puberty blockers. An investigation concluded, quote, the risks of anti-puberty and hormone treatment for those under 18 currently outweigh the possible benefits. The UK conducted a review and called the evidence very low. They've also placed severe restrictions on the care that Dr. McNamara calls life-saving. Norway also analyzed the data and has made similar changes in policy. The National Academy of Medicine in France warned, quote, great medical caution must be taken in children and adolescents, given the vulnerability of this population and the many undesirable, even serious complications the therapies cause. Doctors in New Zealand and Australia have published similar statements. Is Dr. McNamara suggesting that all these countries are rejecting evidence-based treatment and placing their kids at risk of suicide? Regarding that point of view, Finland's gender expert, Dr. Rita Kaltiela, said, quote, it's purposeful disinformation, the spreading of which is irresponsible. All 7 countries, and Florida too, of course, concluded that kids don't need their development interrupted, the girls don't need their periods stopped and their voices lowered, and the boys don't need to grow breasts. What they need is psychotherapy. I have other objections to Dr. McNamara's testimony. She insists that her position, only hers, represents standard medical care. What she doesn't want you to know is that there is no standard. There's a debate. There's a fierce debate. And on the side opposite her stand such prominent figures as Stephen Levine, Kenneth Zucker, Paul McHugh, and James Cantor, among others. These doctors are giants in the field. They have been treating transgender patients and gathering data and publishing papers about them, and I mean no disrespect here, but since before Dr. McNamara was born. The point is that those veteran clinicians and others who have wisdom and experience are ignored because they disagree with the current narrative. They're against medical interventions for the same reason those 7 countries are. There is no evidence of long-term benefit, but there is evidence of harm. I'll end by quoting Jamie Reed, the courageous whistleblower from the Children's Gender Clinic in St. Louis. I believe that that hospital receives the medical education funding that we're discussing today. She said that doctors at that clinic said, we are building the plane while we are flying it. We are building the plane while we are flying it. That's how they described the treatment at their gender clinic. Our precious tax dollars should not support such a perilous experiment. Thank you.